Dear doctor, during the pandemic and after the pandemic, online consultation is at an all-time high, especially in crowded, traffic-laden metro cities such as Mumbai and Bangalore. Even after the pandemic, patients continue to consult us online. You might have always had some concerns about online consultation, but now there are official guidelines from the Government of India that dispel some of the myths. I'll try to clear some of them in this short video. Number one, WhatsApp cannot be used for teleconsultation. This is not true. The guidelines clearly state that any platform can be used for teleconsultation. So you can use WhatsApp, Telegram, email, Zoom, and many such platforms. Although WhatsApp is perhaps not the best platform for this, we will leave that discussion to another video. You must ensure that there is some record maintained of these teleconsultations. So choose a platform where it is easy to document all of these. Number two, digital prescriptions are not valid and you have to provide a physical prescription after the consultation. This is also not true. The guidelines insist that chemists should honor digital prescriptions, and the same is valid for radiology centers as well as labs. Although, please ensure that the prescription is duly signed, stamped, and always carries a prescription validity date. Number three, antibiotics cannot be prescribed in a teleconsultation. Again, not true. Antibiotics can be prescribed in a teleconsultation. Just ensure that the prescription is legally valid. And that brings us to point 4, the things that cannot be prescribed via teleconsultation. Scheduled H drugs can definitely not be prescribed via a teleconsultation. Same goes for number 5, injectables should not be prescribed by a teleconsultation. You must request the patient to visit the nearest hospital or medical center or to another doctor where it can be examined and prescribed. This brings us to examination, point number 6. Doctors think that if they have to teleconsult or consult digitally, they cannot physically examine the patient. They have to forego the opportunity to physically examine the patient. Not true. As a doctor, if your clinical judgment states that you need to examine the patient to make a better diagnosis or be able to prescribe, you can insist that the patient should consult you in physical presence or personally and refuse the teleconsultation, requesting the patient to visit the nearest hospital if they can't come to you, or the nearest medical center or some other doctor where you can state that physical consultation is required. So dear doctor, do exercise that right whenever required, and you feel that you cannot or it would not be the best interest of the patient or best interest of medicine to be able to consult digitally, please do exercise that right.